Hello. Thought it was time for an update. It's been like 2 weeks, hasn't it? So I have actually been at home. I've been out of hospital since the last video, so it's 2 weeks, 2 glorious weeks of being at home. On the night actually of the last video, there was a suspected chickenpox case on the ward, the lady opposite me, which was a bit scary. So I didn't want to be on the ward anymore. They couldn't guarantee there'd be a isolation room for her. So because they were talking about discharging me anyway, they did say that they were willing to discharge me. They'd rather I'd be able to stay, but they didn't mind. So yeah, I went home that night actually, and then just went into clinic on the Wednesday. So yeah, since then my liver enzyme shot right up again. So the alt was in 800s again. The bilirubin was in the 50s. Didn't have any visible jaundice or anything like that. So they kept me on. Well, they'd taken me off the posaconazole because obviously that had caused maybe the issue the first time. They put me on something called ambisome, which is a 3 times a week IV, but I'm doing that as an outpatient, luckily. So at this point, it could sort of still possibly be a little bit of liver GVHD or reactions or a bit of both mixed together. So yeah, that shot right up, and at the clinic they said if it goes up more, we're probably going to need to look at maybe doing a liver biopsy and seeing what we can do. But that day's blood test, it had actually come down quite considerably, which is great. So I'm just hoping that this week it's kind of the same trajectory, and which means hopefully sort of the steroids are working or everything's kicking in, or it was a transient reaction to something. Did actually put the steroids down. I was on 100 milligrams. It's obviously quite a big dose. I'm hungry all the time. I mean, I was hungry all the time before, I thought, but that was nothing. This morning at 5 a.m. I was Googling kedgeree recipes and thinking about that. All I think about is food. So that might stop a bit as it comes down, maybe. I also don't sleep, obviously, hence the 5 a.m. recipes, but, you know, I'm told that's a normal steroid kind of reaction. My skin rash, which was most places... it started as a kind of follicular, right, and each follicle was really red. I was really discoloured in some places. That's kind of on its way out. I've been using topical steroids for that. So my torso is now skin coloured. Like, I keep looking at my arm, being like, "You're an ordinary looking arm, aren't you?" Which is great. Kind of moved down my body. It's following the same path where it's kind of dots, the red dots, and then it goes to a sort of strange discoloured dry bit, and then to skin. So that's now happening on my legs. So hopefully that's just going to keep working its way down, going away, which is great. I've got kind of dry eyes. It's nothing too bad, but I'm going to bring that up on Wednesday. Bit of a dry mouth. For anyone who's getting a dry mouth, I think I've got a bit of oral GVHD, so I'm having to swill a steroid, which is fun, 4 times a day. But if any of you have a dry mouth, I've got a mouthwash called Biocene, which you can get from Amazon, and it's actually really good. Who knew moisturising mouthwash existed? And now, in the way that my hands peeled all their skin off, I don't know if I mentioned that in the last one, maybe. My feet are now doing that to a point, pretty gross, but not painful or anything. My feet did really hurt for a bit, but I found like massaging moisturiser into them seemed to really help, right, if I did it really hard. So I think it's all par for the course by the sounds of it. So I'll just wait and see how my bloods are doing this week. Last week my platelets had gone like slightly low, just slightly lower than normal. White blood cells were slightly higher than normal. He didn't mention it, so I figure it's not a big deal, but hopefully this week it'll be the same or stabilised. So that's kind of where it is. And I'm eating all the lovely food I can at home, sleeping in my own bed, and hoping may it long continue. So, bye!